Assalamu alaikum students, welcome back to Therapy Kingdom. Today we are discussing a pressing global health concern, monkeypox, which cases rising worldwide. It's essential to understand this virus, its symptoms and how to protect yourself. So without any further delay, let's start the video. Monkeypox is a disease caused by the monkeypox virus. The virus belongs to a group of viruses called orthopox virus. This group also includes the variola virus that caused smallpox and cowpox virus. Monkeypox was first discovered in Denmark in 1958 when monkeys kept for research developed a pox-like disease characterized by the skin eruption, and that's how the disease got its name. The first human monkeypox case was reported from the Democratic Republic of Congo in 1970. Since then, numerous cases has been reported from countries across Central and West Africa. Cases outside these countries has usually been associated with travel from those regions. However, recent cases have occurred with no travel history. Monkeypox is a zoonotic disease, which means that it is disease of animals that can be transmitted to humans. Although the virus can be carried in many animals such as squirrels, rodents, and different species of monkey, the natural reservoir of monkeypox has not yet been determined. The likely way it is transmitted to humans is through direct or indirect contact with infected animals. This could be through a bite or scratch during preparation or eating inadequate cooked animals that are infected or by direct contact with blood or bloody fluids of infected animals. It can be transmitted from person to person through face-to-face contact through respiratory droplets. Contact with bloody fluids of an infected person such as from skin lesion or from object contaminated with virus such as bleeding. Family, partner, or anyone with physical contact and health co-workers are at high risk. The virus can also be passed from mother to fetus through placenta. So what are the symptoms? The incubation period, which is the time from infection to when symptoms appear, is usually from 6 to 13 days but can range from 5 to 21 days. The disease usually starts with a fever, headache, muscle ache, back pain, and lack of energy. A characteristic feature is a swelling of lymph nodes. A widespread rash develops usually starting on the face and spreading to the rest of the body. The rash starts out as faceless lesion with the flat base progressing to pustules, which are raised lesions filled with the yellowish fluid. These later crust and the scabs fall off eventually. The illness usually gets better on its own after 2 to 4 weeks. However, complications can occur, such as secondary bacterial infection, encephalitis, pneumonia, sepsis, and corneal infection, which may lead to the loss of vision. Children and those who are immune suppressed have worse outcomes. The case fatality ratio, which is the proportion of people who die from the disease, ranges from about 3 to 6%. So, how is it diagnosed? Polymerase chain reaction (PCR) detects the genetic fingerprints of the virus as the best test to diagnose the disease. This is usually done on samples from skin lesion such as fluid or crust. Testing blood from antibodies against monkeypox is sometimes used, but because antibodies cross-react with other related viruses, it is of limited value. And how do we treat monkeypox? The mainstay of treating monkeypox is to provide supportive care and prevent or manage any complications. One antiviral has recently been approved in some countries for treating monkeypox. Other antivirals and therapeutics, such as immunoglobulins, are currently being evaluated. How about prevention? Prevention activities include raising awareness of the disease, including risk factors and public health measures such as surveillance to identify cases of those who are sick and effective tracing. Practicing adequate infection control measures is essential when caring for patients with the disease and handling samples. There are several vaccines developed for smallpox that are also effective against monkeypox. There is a new vaccine that has been approved for the prevention of the monkeypox. So that's it for today's video. Thanks for being the part of the Therapy Kingdom. I'll see you in the next one. Don't forget to share, comment and subscribe for more content.